External cervical resorption, a volumetric analysis on evolution of defects over time, done by Nosrat et al. In 2022, an American group. External cervical resorption presents as a challenge for the endodontists. The specific etiology and progression rate of the region remain elusive, so several studies shows association between the external cervical resorption and orthodontic treatment, a history of trauma, parafunctional habits, cracks, restorations, periodontal surgeries, internal bleaching, hepatitis B, and bisphosphonate therapy. Most of the cases are asymptomatic and diagnosed as an incidental clinical or radiographical findings. So the aim of this study was to assess the temporal evolution of external cervical resorption defects using a volumetric quantification method. CBCT images of patients diagnosed with the external cervical resorption who choose not to receive a treatment and attend recalls were collected. The defects were segmented in the CBCT images at a baseline and recall, and their volumes were quantified. The volumetric ratio of resorption defects over teeth was calculated. 3D classification of defects at a baseline and recall and the prevalence of a root surface perforation more or equal to 1 mm were determined. For the results, 15 patients with 20 teeth diagnosed with external cervical resorption and an average recall time of 21 months were included. 9 teeth, 45%, shows a change in a 3D classification at a recall. The prevalence of root surface perforation more or equal to 1 mm were higher at the recall, with 85% compared with the baseline, which is 45%. There was no association between the volume of resorption defect at a recall with the length of the recall period, sex, or age. This studies shows some limitation because it is a retrospective cohort study. For the sample size, it was very small, and the demographic distribution was not uniform because most of the patients were females, and most of the teeth were anterior, and the recall period was not standardized. So, as a conclusion, when left untreated, external cervical resorption defects can increase in size and develop more root surface perforations. The external cervical resorption has a dynamic nature, and its volumetric increases over time does not result from a uniform linear expansion of the defects.